warned that you should not feed babies certain foods that can trigger a food allergy. But now there's new information on this. In fact, it's showing us that we can introduce foods such as peanuts, fish, and eggs as early as 6 months of age. And this is according to the Canadian Pediatric Society and the Canadian Society of Allergy and Clinical Immunology. Joining us right now with more on this, we have Dr. Joelene Huber. She's a pediatrician at St. Michael's and Sick Kids Hospitals in Toronto. Good to see you, Doctor.
Hello, thanks for having me.
So, to talk to us about this, what appears to be, I guess, for some on the surface, a sudden change, because for a lot of parents, they were told, do not introduce things like eggs and peanuts when you have a young child. So, why is this different now?
Right, so in around 2000, the American Academy of Pediatrics had recommended at that time that parents delay the introduction of allergen-producing foods, so things such as cow's milk protein not until 1, eggs not until 2, peanuts and fish not until 3, and part of it was that children could be observed, they thought, but it was just based on expert opinion and not actual evidence or research. But since then, there's been growing research around this area, and in 2008, the American Academy of Pediatrics put out a statement saying that in children, even in children of high risk, so those that have a first-degree relative with an allergy or eczema, which are the kids that we're a lot more cautious about in the past. So in 2008, the American Academy came out saying that we don't necessarily need to delay that, and so the Canadian Pediatric Society today has put out their position statement saying that we don't need to delay food even in infants who are of high risk.
Yeah, I think a lot of people might be a little surprised at some of what you said, and that is that up until this point there's never been real research done in this area. Is that in fact true?
No, there's research done in this area, but there hasn't been enough research. I mean, it's enough research to really fully understand whether if we prevent and if we delay, if that's actually, the question is that it could be actually maybe contributing to allergies. So, for example, in some cultures, they don't have this sort of delay of peanuts or peanut butter, and there's, in fact, in some cases, less allergies in those cultures or countries than in some of the countries that have made recommendations like we had. So that's, as we're getting more and more research, and more research is needed, we're starting to understand that there's no evidence that it will actually prevent an allergy, and in some cases we may be promoting allergy by delaying the exposure.
Boy, so it's got to be confusing for a lot of parents then, because you know what they're going to waver. They're going to say, do I risk then introducing these foods? Do I risk my child getting an allergy if I don't introduce them? And even when you do introduce them, you have to do it in a certain way, right?
Yeah, so we say that at 6 months of age you can start introducing, because there's no evidence that by delaying it you're actually preventing allergy, and in some cases there's starting to be evidence that it may be promoting allergy. So we say that you can start once an infant is 6 months of age, when you're starting solids and purees. You can introduce things like cow's milk protein, peanut butter, and what we do also think is that it's most important that once you introduce it, you should probably introduce it sort of one food at a time, so 1 week at a time. Introduce it in the morning so you can watch your child all day or your infant all day, and then it is probably also important that to build up the tolerance to that food that you're giving it to them multiple times or several times throughout the week, so that you don't just sort of introduce it once. You say, well, you've introduced it
and don't return to it, right?
And that's what's really the really important point.
Well, that
here.
part certainly makes sense, I think, for a lot of people listening. Dr. Joelene Huber, good of you to take the time to talk to us. Appreciate this. Thanks.
Thank you.